Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Jim Golan. You may remember that Jim got COVID-19 in March of 2020. All these months later, he's still suffering from devastating long-haul symptoms that make it hard to work, to walk, and even sometimes to breathe. They talk about this mostly ignored population of COVID sufferers, those who survive but don't recover. Let's listen. Jim Golan, thanks so much for joining me.
Yeah, good morning, Stephanie. It's nice to be back, and thank you for having me.
Yes, I'm so happy to have you back. Let's remind our listeners sort of about the journey you've been on. You were diagnosed what later came to be known as COVID back in March of 2020, and you are definitely a long hauler. Could you talk to us a little bit about the beginning and where you are today, health-wise?
In the beginning, I barely survived it at home, and I had a really hard time with the lungs and with just devastating fatigue. Pretty much every symptom of COVID I had in the beginning, and then it developed into pulmonary embolisms. And most recently, they found that I did have those ground glass opacities in my lungs. And I had those all along, and they were being misread on the CT scan. But I got a really good pulmonologist, and he said, I do have still classified as severe restrictive and obstructive lung issues from COVID. My lungs were about 44% about 6 months ago, and now I'm up to 55%. So it is, it's possible that I'm getting better, he said. He said most people will get better within 6 months, but he's surprised that it's still hanging on so long with the shortness of breath, especially with talking. So apologize for that. But and walking and, just doing that everyday things. But I can't even count the number of relapses that I've had. If you overdo it, you really pay the price as a long hauler. If you try to exercise or do more than a half hour of exercising, for me, I get all the symptoms back of, the tremor and the brain fog, and especially the lung pain at night. I think that's the hardest part, is the uncertainty of recovery with this thing.
Mm-hmm. Mm-hmm. So when this happened, you were a nurse, correct? Tell me about that.
Yeah, I was doing home care in northern Minnesota, and I was exposed pretty early on, very early on. I was seeing patients in their homes and in long-term care facilities, assisted livings, and doing a lot of in-office work with a lot of other nurses who were doing the same thing. So I'm quite certain that I did get this at work. Been fighting with for workers' comp ever since. So that's about where I'm at right now, trying every day to make it through.
You haven't been able to go back to work.
I have not. Seems you have to be able to breathe to be a nurse. to bend over and take care of leg wounds and things that I used to do as a home care nurse, or even walk with the patient to assess their ability to walk. It makes it very difficult if I have to ask if I could borrow their walker or or their cane. So I'm going to hold off on going back to work for now. Also, you have to be able to think, setting up medications for a patient. I used to set up, up to 45 medications in one sitting. And now my wife helps me set up my medications. So the brain fog some days is really bad. Others, I feel normal. but you just never know what you're going to get.
Mm-hmm. This hasn't been easy on you psychologically.
No, I have. I've never been a depressed person, but the COVID long haul has kind of chipped away at what I once was and what I can do. I went through many of the stages of grief. I know them well because I used to do hospice care as well. But, the denial and isolation, that was a given in the beginning. Anger, bargaining, depression. But I'm not willing to accept that final stage yet, which is acceptance. I still think that I'm going to get better. I'm going to be fighting this thing. It's been 18 months, well, almost 19 months now. But when I was a home care nurse, I would take care of people, chronically ill people all the time. And they've had to change their identity based on being chronically ill. And I knew that taking care of them, but actually when it happens to you, it's quite different. I was prepared for it a little bit because of my background, but it changed my identity totally. And that I lost my job, can hardly take care of the house. Friends, they distance themselves from you because they don't want to be around people who are sick. I have a few good friends, but I got really lucky in the area of family. A lot of the long haulers do not have that. And, crushing debt of a lot of the long haulers, because there's a lot of medical tests. And I'm pretty much through all the testing. And for me personally, it's the lungs have been the issue the whole time. But health is the biggest part of my identity. I used to run 3 miles a day, and breathing, thinking, and exercising were very important to me. But I think I am getting better. I do still have the days where I have a difficult time breathing.
You've written about this. You write in a journal, and you've written sort of about this loneliness and asked yourself questions. Is it enough to just exist? And I'm wondering if you could elaborate on that.
Did you want me to read that or just?
I just was curious if your take on it.
A lot of it is when your identity is taken away, just totally taken away, and you can't do the things you used to do. You have to reinvent yourself. And in order to do that, there's a lot of different paths that you could possibly take, but you don't know if you're going to get better yet. You don't know if later on you're going to be able to breathe. So you can't really plan. I look at the job boards and there's a lot of people trying to get me to work for them, but I just can't right now. So I'm in this state where I'm just existing right now. Mm-hmm. Just hoping and waiting for it to get better. You can't really exercise. The identity thing is big. That's what my writing to exist was all about. Mm-hmm. Looks. I gained a lot of weight. I went gray a little bit, quite a bit, and the identity thing is just tied up with existence.
Mm-hmm. It's interesting because I feel as though we think about COVID generally as a binary thing, right? You have it or you don't, and you get better or you don't. And when you don't, it means that you've died, right? People aren't thinking, I think, about the long haulers, which there are many, many of you. Do you feel like you're being forgotten?
Definitely. The focus on long haulers has kind of went away. I'm sure you noticed that in the news. People don't. I'm surprised at how many people out there still don't think COVID is even serious. That the long haulers don't exist. Like you said, there are hundreds of thousands of us now. Even some physicians are in denial that it exists. They seem to focus only on the physical and not on the emotional. In the beginning, for me, it was they tried to focus only on the emotional and not look at physical. this is all depression. This is all in your head. And then the pulmonary embolisms pop up, and then the B12 deficiency pops up, or the ground glass opacities. But now after 18 months, the emotional part starts to take over, and you're fighting for your existence.
Mm-hmm.
The hospital beds are so full of COVID patients right now, of people who made the bad choice of not getting a vaccine. And so people who really need it for other things aren't having a bed. Well, we had a friend of the family recently had stage 4 colon cancer, and she started up on chemotherapy. Well, her colon perforated. There were no beds in northern Minnesota, so she ended up having to take a ambulance to southern Minnesota to get treatment. 4-hour excruciating drive. So there are. It's nice to say that there's an infringement on my freedom to get the vaccine, but the choices actually do have consequences for other people.
Mm-hmm. How do you feel when you see these people? I mean, not far from you, there are several states where people are not really getting vaccinated. They're very, very low vaccination rates. And obviously you couldn't get a vaccine when you were, before you got sick, because it was a brand new virus. And now there's this opportunity to be vaccinated, which, everything tells us is very effective, especially against serious illness and hospitalization and death. How do you feel knowing that people could avoid the predicament you are in and they choose not to?
It's actually very unsettling, very, very scary, actually. I do have some family members who are refusing to get vaccinated. And on a personal level, I fear I'm going to lose someone in the family, because there's quite a few of them. And Minnesota, I think, ranked number 7th in the United States for new cases recently. This last week, I read. So it's very frustrating. I guess what's most frustrating is when people who make that decision try to make that decision for others. I've personally been accosted at estate sales because I'm wearing a mask. Why are you wearing a mask? And so that part is really frustrating, and I don't understand it. I think common sense needs to kick in sooner or later.
When they say, why are you wearing a mask? Do you tell them?
Oh, definitely.
Yeah. What do you say?
Yeah, I tell them that it's very serious and that I have permanent lung damage because of it, because of COVID, and I'm not willing to go there again, because if I catch it again, I could possibly die. Mm-hmm. And then I recommend that they use a mask, which doesn't always go over well.
You would think that they might listen.
Yeah. Yeah, it seems common sense to me, being in the healthcare field. I have my son and daughter-in-law that are ICU nurses, and they're absolutely full. The beds are full in the cities. And my daughter is an echo tech, and she's seeing patients all the time with it. And almost everyone who's in the hospital has not been vaccinated. So it puts them at more risk too. So, frustration is one thing, anger is another. I do get a little bit angry sometimes that people are making that decision, but it puts our healthcare people at risk.
Absolutely. What advice do you have for other long haulers?
I'd like to say, if there are other long haulers who may be listening, to hang in there. I've kind of lost hope in the last few weeks because I had a really bad relapse recently, and I've noticed at around the 18-month mark, there are a lot of people who are in the same boat. I guess I would just say hope is a place that you create in your mind, and it's only a place that you can see through your current darkness. But to let them know that you're definitely not alone, whether they're covering it on the news or not, you are not alone.
Are you in online support groups?
I am. I have Survivor Corps and a few of the others. It seems to me like there's been a lot of talk about the long haulers who caught this in March and April of 2020, and it seems to have hit us harder. I don't know why. There's a lot of speculation as to why when it first came out. But there are a lot of extremely ill people who are still battling this from that time frame.
Jim Golan, thank you so much for sharing your story.
Yes, thank you for having me again.
Feel better.
Thank you.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.